Thank you for joining us. We're going to talk about prediabetes prevention and general glycemic health, actually. These are the objectives for this course. I don't know how many of you have actually been in the previous two courses, but Carol and Christina did a wonderful job of getting us started on learning about our glycemic health. So we are going to continue throughout this year. Hopefully I'll get to know some of you, to offer this forum to encourage people to get their blood sugars down, possibly lose some weight, keep from progressing to type 2 if you are pre-diabetic. We're also going to talk about healthy behaviors that are part of being pre-diabetic and keeping from going to type 2 diabetes. So our program goals: losing weight, eating healthy, and getting active. So hopefully, if you follow the program that Brad sent to you in your email, it is a workshop program where you could lose up to 7% of your body weight, eat healthy meals, and become more active. Keeping from becoming type 2 diabetes can also help with preventing heart disease. So I want to give a shout out to the Diabetes Prevention Program. It is actually a workshop curriculum that was based on a research. We have to give them credit. We are not necessarily using their program exactly because it's supposed to be within a 6-month program limit to get started. We are using some of their literature, and we want to make sure that we credit them. And there's no fee getting charged for this. Most people who go to a prevention program have to be 18 or older, overweight, not ever had a diagnosis of type 1 or type 2 diabetes, and then have had one of the following: usually been diagnosed with prediabetes, which we're going to talk about in a few minutes, and or had gestational diabetes, and or at high risk on a risk test if you took the CDC risk test. We're going to review a little bit of what was presented in the previous lessons: some pre-diabetes, type 1 diabetes, type 2 diabetes, gestational diabetes. We're going to talk about the program parameters and what you learned in lesson 2 about being a fat and calorie detective. So the road to type 2 diabetes often starts here. Normal blood sugars are usually 99 or below in the fasting state. This green light here in the middle bottom. If you're pre-diabetic, your fasting sugar can be between 100 and 125. Once it goes above 126 in the fasting, they're usually thinking that you're probably become type 2 diabetic. Also, numbers that they look at are your A1C. If you've heard of that A1C, it's a hemoglobin number that shows the variableness or ranges of your blood sugars over a couple-month period. Your bones continue to make blood cells. We don't want to hold sugar in our blood. We want it to go out where it needs to go, to all of our organs. So if you're holding sugar, your A1C increases. If you are still in this range, the 5.7 to 6.4, you are pre-diabetic. Once it goes above 6.5, you're probably type 2 diabetic. Saying that, I just want to say that type 2 diabetics, please stay on, because you could benefit from a lot of the teaching that goes with this curriculum. Preventing diabetes, eating healthy, losing weight are all good for type 2 diabetics as well. Diabetic disease process definitions we're going to talk about. I'm just going to skip through this page because we are going to go to the diagnosis. Prediabetes. It's usually when your sugar has increased enough in the fasting state that you are headed toward type 2 diabetes, although you may not be there yet. It's usually higher than normal, but not quite type 2 numbers. They usually don't have any symptoms of prediabetes. You usually develop prediabetes before you develop type 2. And If you follow a treatment plan similar to this, where you eat healthy, become active, possibly lose a little weight, you can delay and or prevent yourself from becoming diabetic. We want to keep your A1C in this healthy range and or below. Type 1 diabetes does not usually become pre-diabetic first. Type 1 diabetes is your pancreas not making enough insulin. Usually it's an autoimmune type disease. Type 1 diabetics can still benefit from healthy eating, managing their blood sugar with medications and insulin, getting their regular checkups and attending classes. This is where we want to keep from going to. Type 2 diabetes. If you can't get enough insulin from your blood, from your pancreas to your blood to allow that sugar to get out and help your body, then your type 2 diabetes can be because it was insulin resistant and you have a little bit of heaviness maybe around the waist. If you develop type 2 diabetes, you can have issues with heart disease, vision loss, kidney disease, wound and skin healing. We want to keep from having any of those sequelae or adverse reactions. Gestational diabetes is another type of diabetes, usually goes away. Usually it happens later in pregnancy with women who are having trouble with insulin resistance. We also teach the gestational diabetics how to eat healthy, how to keep from gaining too much weight, how to live healthy lifestyle so that they don't develop type 2 diabetes after the baby is born. Other diabetic concerns we won't deal with right now, but we may by the end of the year, are things like women who have polycystic ovary syndrome. They can develop type 2 diabetes. Monogenic diabetes is another type of diabetes. Different endocrine disorders and issues with type 2 and or type 1 diabetes that we may deal with later in this class. I want to stop for a commercial. I want to talk about Zoom classes, which thank you for joining our Zoom classes. We are going to have continued classes once a month. The next class is going to be May 9th. We will start having diabetic self-management education when we get our program back up and running. It will be the third Tuesdays and Wednesdays of each month. We will have individual evaluations for diabetic education and or dietary counseling. Currently, we are doing Purdue cooking classes. They are Monday at Southlake and Thursday at Northlake. The woman who comes and does the Purdue cooking class is wonderful. She has a lot of great information. Anyone is welcome to come to these. You don't need to register. You can just show up. She will be there each Monday and Thursday. Usually it's a small class. This last class, we had 3, but it was wonderful. We had a lot of good information. We also have a health fair coming up April 20th. Anyone is welcome to come to that. It is not just going to be about diabetes, but it has a lot of good information for blood pressure, wound care, diabetes. You're welcome to come to that. Please call the Diabetes Center and or the registration number for any questions or concerns or to sign up for any classes.
And Val, I'm just going to interject real quick. So for everyone, the health fair, you can call the same registration number that you registered for this to get a time slot for the health fair. We are
excellent.
doing a free blood test there, and part of that blood test is your A1C number.
Beautiful. So then you would know, you would have a knowledge of where you are on the normal to pre-diabetic scale.
Yes.
So this is our cooking class brochure, but you're welcome to come. You don't necessarily have to call to register. You can just show up at these times. Just make sure that you note that the Northlake time is 2 and the Southlake time is 1. Let us review lesson number one. Lesson number one, which if you've been to the classes already, you know, was that we are using a diabetic prevention program that has you take control of your health, change your lifestyle, change your diet, be more active, overcome any barriers to change, and practice those healthy behaviors continually. Lesson one ended with a goal that you were going to lose 7% of your weight through healthy eating. If you have a goal, you can put that in that blank, but you're going to lose 7% of your weight. So if you take your weight currently and times it by 0.93, you are going to find out how much weight you could lose. That would help you, hopefully, aid you in keeping from becoming type 2 diabetic. Also, the end goal of lesson one was to do 150 minutes of exercise every week. The exercise does not have to be continual 30 minutes. It could be 10-minute intervals. It could be moderate. It could be brisk, but 30 minutes of exercise at least 5 days a week. It's preferable if you don't do all 150 minutes in one day, but if you do 30 minutes for at least 5 days, you can break it up into 10-minute intervals. Lesson one was to be honest with yourself about your goal. Be serious. Are you really ready to make a change? Keep track of the eating and activity that you do. It was for the whole month to see what you ate, what type of activity you did. Be willing to change. Work on improving. Believe you can reach your goals. And be ready for this lifestyle change. Oh, lesson two, being a fat detective. This is just a review of what you already have gone through. So, losing a pound or two every week means you're going to have to cut down 500 to 1,000 calories every day. That is just a little quick fact for you. But right now, we're not worried about calories. We are more worried about the fat grams that you're consuming. So if you look at this chart right here, pick the weight where you currently are and scroll across to your fat gram goal for the day. This is how many fat grams you should total in a day if you are serious about starting to lose weight. I'm going to do this with you. I'm determined. So we're going to say that I'm right here. I'm going to go across and I'm going to eat 50 grams or less of fat grams a day. That would help me in my goal to lose weight. So find your weight, pick your grams, and that's going to be your goal for fat grams a day. Some little facts about fat. You probably know these, and some of them are obvious. But this is part of the curriculum that talks about eat less fat, eat fewer calories. Fat has the most calories of any of the foods that you eat, of any of the macronutrients, the carbohydrates, the proteins, the fats. Fats have usually the most calories. So eating too much fat is going to make you fat. Eating less fat, you can usually lose weight. Fat has the most calories. Even small amounts of high-fat foods can be high in calories. Utilize your nutrition food label. So your nutrition food label has changed recently, and we'll get into this more as the year progresses. But you're going to find your nutrition label. You're going to find the serving size. This is very important. A lot of times we do not follow the serving size. Find the serving size. Find the number of fat grams. If you're going to eat more than the serving size, you know you're going to have more fat grams. So find the serving size, find the fat grams, keep a running total every day, and keep within your, I have to go back here, your fat gram goal for that day. So use your food label. Add up your fat grams, eat only the number you're allowed for the weight, and then weigh yourself every few days. Don't really weigh yourself every day. Don't get in the habit of being that concerned. But weigh yourself every few days, especially if you are on some type of water retention issues with, limited sodium. Make sure you're weighing yourself to make sure that you're not getting some water weight. Read your food labels. Now we're ready to start lesson 3. This is new. So if you attended any of the other lessons, this is going to be moving on. And you should have gotten the email that had the curriculum, and this is going to be part of the pages that you received. So 3 ways to eat less fat, because we're working about fat right now. If you eat less fat, make sure that it's fewer calorie fat. Eat high fat and high calorie foods less often. I like how it starts positive. Eat high fat and high calorie foods, but less often. Eat smaller amounts of high fat and high calorie foods. And then eat low fat and low calorie foods instead of high fat, high calorie foods. These are the 3 different ways that you can decrease your fat intake. This is going to be one of the goals for this lesson. So we're going to have some goals at the end of the lesson today. But those are the 3 ways you can eat less fat. Weigh and measure. Use metal and glass cups for the appropriate food items that you're measuring. Use a scale to measure the weight of your meat, to measure the grams of your food. Sometimes we would be amazed at if we weighed our food, we're eating much more than really what the serving is or the gram size. Use your measuring spoons for your solids and liquids. The only thing I want to say here is make sure that you're doing a level measurement, not a heaping spoonful, but a level measurement, and that you look eye level across at your measuring cup or your spoon, so that you're not getting more than you're really supposed to be measuring. So here's our goals. We're going to eat foods that are high in fat or calories less often. Here's an example that you could use as your goal. Eat French fries only once a week instead of every day. That means you're going to eat 132 fewer grams of fat every week if you ate French fries only once a week. We're a country of fast food junkies. Eating less French fries is going to give you less grams of fat. Number 2 on our eating less fat is to eat smaller amounts of the high calorie foods. So if you go to the salad bar and you use the ladle, you are going to be pouring fat calories into your salad. Where if you used your tablespoon, you might get 24 grams less of fat. So using your spoon for salad dressing or the ladle, the spoon is going to give you a lot less grams of fat. And or put your salad dressing on the side, something that would keep you from pouring salad dressing onto your salad. The third goal for eating less fat is to lower fat and lower calorie foods. Choose non-fat type foods like non-fat milk. Skim milk has a lot less fat in it than whole milk. Some people are worried about the sugar content, but there is similar amounts of sugar. It's just that the non-fat milk has skimmed off all that extra tasty cream. But if you can like non-fat milk, like 2% or 1% milk, you're going to get a lot less fat than whole milk. So eat less fat. This month, pick your top 5 high-fat foods. Eat less of them, eat smaller amounts, and eat lower fat foods. So pick the top 5 high-fat foods that you know that you enjoy. This is personalized, so whatever you know that you already eat. I'll have to say that French fries are one of mine, so French fries may be going by the wayside. Things that have fat. I just wanted to talk about the 4 types of fat that you're going to be coming across. Trans fats hopefully are going out of the picture. They will say hydrogenated oils on your packaging. They are the ugly or bad fats. They increase your risk of heart disease. They add to your belly fat. They also add to your insulin resistance. Things that have trans fats are almost any processed foods. Things that have long shelf life usually have been partially hydrogenated or hydrogenated to keep them longer on the shelf. Not to pick on any foods, but Twinkies, they said, used to last forever on the shelf. That might be why. So get rid of trans fats. Baked goods, margarines, shortening or lard, fast food like French fries. In America, they have some rulings that trans fats are supposed to be getting out of our fast food fries. We'll hopefully see that. Other foods to avoid or decrease: saturated fats. Fats that are solid at room temperature. They can increase the LDL cholesterol, which is the worser of your cholesterols. But they also increase HDL cholesterol, which is your good cholesterol. They're usually animal products and tropical oils. These are a lot of the saturated fats that you want to try to decrease. I'll let you just look at that list. Alternatives to the high fat choices are your polyunsaturated fats. These are essential fatty acids. Our body cannot produce them. They should be part of our healthy diet. They would help lower our LDL, lower our risk for heart and stroke diseases. Alternatives that are polyunsaturated are things like your oily fishes, your nuts, especially walnuts, flaxseed oil, canola oil, eggs, sunflower seeds, peanut butter. Other alternatives to high fat choices are these monounsaturated fats. They're considered healthy, a part of a balanced diet. They lower your LDL, but they're sometimes very high in calories, so you have to watch the calories. Uh-oh, I read that wrong. I'm sorry. The polyunsaturated. Oh, I'm sorry. I put that wrong slide on there. I'll have to fix that for the next time. We're going to eat less fat. We're going to eat it in smaller amounts, and we're going to eat lower fat, lower calorie foods. In your packet that you got, there's some examples of, instead of eating this food on the left side, if you chose this food, how the fat and calories would be different. The warning is that sometimes low-fat foods are very high in calories, so you have to look at that. I'm also going to say that sometimes low-fat, low-carb, high keto foods have a lot of sodium, so be careful of the sodium amount. Then lesson 4, we are going to start lesson 4 because we are going to talk about healthy eating. The government issued, the USDA issued a healthy plate, My Plate. This is very similar to the diabetic dinner plate method that we suggest, which we are going to talk about next month. But My Plate is recommended for people to eat healthy, and that's where we want to start. We're decreasing our fats, and we're going to start eating healthy. So we're going to fill up our plate, half of our plate, with non-starchy vegetables and a little bit of fruit. You want to be sparing on the fruit because it is high in sugar, high in carbs. You're going to have some grains, more whole grains. Don't be fooled by the ones that say multigrain or different grains. Make sure it says whole grains. And then your proteins. The diabetic dinner plate looks a tiny bit different because it's going to be half your plate vegetables, non-starchy vegetables. The fruits are off to the side. And we're going to have a little bit of dairy. Healthy eating. That is what this lesson is, healthy eating. Everything you eat affects your blood sugar, your blood pressure, your cholesterol, your weight, your general health. The My Plate is based on your sex, your age, and your level of activity for the food choices that you can have. If you go to choosemyplate.gov, you can learn more about this tool. My Plate suggestions help you decide what you can eat. Other healthy eating things that you're going to learn in your packet are eat healthier, eat at regular times. Eating at the same time every day helps your pancreas function more efficiently. Not binging, not skipping. Eat slowly so that you digest better. Eat slowly because you become more aware that you're full. Don't feel like you need to clean your plate. This is one for me that I have to work on because your mom ingrains this in you to clean your plate. And then change your eating environment. Sometimes you don't need to sit in front of the TV. Sometimes you need to sit separate at a table, outside on the porch, something to change your eating environment that you're not just eating mindlessly. Healthy eating means you're going to choose My Plate this week. You're going to eat at least half of the grains as whole grains. Vary your vegetables. Eat an abundance of color. I've heard it said that you should eat the rainbow. All the colors of the vegetables will help you eat healthier. Fruits in moderation. Focus on fruits, not fruit juices. Juices don't have the amount of fiber that you need, especially if you're trying to keep your blood sugar down. You're going to get your dairy with your calcium-rich foods. And proteins. Go lean with your protein. Try to eat lean meats. That's why we say chicken and fish rather than a lot of steak and ground beef. I'm going to leave this slide on for a few minutes because this gives you some ideas for healthy eating. You want to eat more of the left side and limit the right side. A lot of these are kind of no-brainers, but on the left side, you're going to see the non-starchy vegetables, a lot of green leafy things. About the only thing that is green that maybe you don't want in this section are peas. A lot of green things, lean proteins, fish, sardines, trout, tuna, your chicken, your turkey, and of course this is without the skin. Eggs, nuts, and soy foods are good lean foods. Your plant-based oils, like your vegetable, olive, and canola oil. And then your small piece of apple, orange, pear, peach, and then maybe a small cup of berries. This left side are good things to put on your plate. The right side, limit these foods, limit them in abundance. Anything that has added sugars. Added sugars are not natural sugars. They don't have a low glycemic index, so please avoid the added sugar foods. Avoid high-fat meats. A lot of processed meats, especially hot dogs, cold cuts, are high-fat meats. Foods that are high in saturated fats, the ones that have the tropical oils, coconut and palm oil, were once touted as very good for you, but they really actually are very high in saturated fats. And then your salty snacks, all this processed foods or fast foods you want to avoid. Healthy eating goals for this month. You're going to use My Plate. You're going to have a regular pattern of eating. Eat slowly. Don't worry about cleaning up your plate and change your eating environment. So healthy eating dinner plate should look like healthy food, not processed. Helpful hints to eat this healthy dinner plate is choose a smaller plate. Use the 9-inch plate. Don't use your big dinner plates. Choose to ask the restaurant server to bring you the take-home box as soon as your meal arrives, so you can take part of it and put in the box and save it for your take-home food. Restaurants almost notoriously serve you more than you really can or should eat. Fill half your plate with your non-starchy vegetables and choose your low-fat, low-carb foods. Eat slowly. Now we're going to change it up a little bit because we are going to add to our program the healthy behaviors that are helpful to keep you from developing type 2 diabetes, and or if you have type 2 diabetes, help you control or manage your blood sugar and your A1C. There's 7 healthy behaviors. We are going to talk about all 7 of them just quickly. They are going to come up in the months ahead. So healthy coping. Prediabetes and diabetes definitely affects your body and your emotions. You have to learn a coping mechanism. This little boy, I love him. He's coping with the rain, not with his umbrella, but by playing. You need to name your unhealthy coping and replace it with a healthy coping strategy. I'm going to tell you what mine is. It's denial. There's all kinds of stresses in our lives nowadays. Mine is denial. I am going to be the first to say that I did not want to admit that I am pre-diabetic. I kept telling my kids that prediabetes is like pre-algebra. All math is pre-algebra. All of life is prediabetes, but it's not true. If you have a little bit of overweight, weight gain, a little bit of high sugar, A1C is rising, you are pre-diabetic. I am pre-diabetic. So I'm going to start this journey with you. I'm not going to be in denial anymore. My coping is going to be to accept. I'm admitting, I'm accepting, I'm going to say yes to this new adventure. You need to find your unhealthy coping and replace it with something healthy. Healthy eating, we've talked about. This month, we're going to work on the healthy diet by choosing My Plate. Try to eat as healthy as you can this way. Counting carbs is part of a healthy diet for diabetics and or pre-diabetes, but we are going to talk about this in the months to come. Being active is one of the healthy coping or behaviors that we're going to do. A little bit of activity goes a long way. It doesn't have to be, hard exercise. It can be moderate exercise. It could be just moving. Sedentary lifestyle contributes to type 2 diabetes. So we definitely want to get moving. During COVID, a lot of the things that people did were inside. You can still do things inside. When you're watching TV, get up and walk around your chair. Walk back and forth to the kitchen to get your glass of water. Be active. Medications are another one that is part of our healthy behaviors we're going to start dealing with. Monitoring. I'm just going to stop here for a minute because I'm going to say some of you may be monitoring your blood sugars already. If you are, I want you to know that if your blood sugar is high or low, we're going to talk about those signs and symptoms, treatments, prevention, recognition in the months to come. Reducing risk. This is where we want to be in our journey. There are some things that we cannot reduce. We can't change our age. We can't really change the disease process if we already are type 2. It is a progressive disease, diabetes. That's why we want to prevent it. Our ethnicity, we cannot change. Our family history and genetics, we cannot change. Oftentimes, we can't change illness or injury or infection, but we definitely can treat illness, injury, and infection, and the sooner the better. Surgery can be a risk factor, and medications. Risk factors that we can modify or deal with are things like our diet, which is what we're doing now. So this month, we're going to have goals. We're going to talk about those toward the end here. We're going to exercise starting next month in our lesson. So come ready with your tennis shoes and your comfy clothes. We're going to do some hands-on exercise. Be ready. Stress is a risk factor we can modify. The choices we make in our life. Things like stopping smoking, not drinking alcohol, taking our medication that we're prescribed, controlling our blood pressure, lowering our cholesterol. These are all things we can modify. One of the healthy behaviors is problem solving, and I want to tell you and thank you. You have made one of the steps in the healthy behaviors, problem solving, by starting a journey of preventing diabetes or preventing your pre-diabetes from going into type 2 diabetes. So we're going to set goals. We're going to be specific with our goals. We're not going to be generalized. You're going to say a goal of, I'm going to eat 3 meals a day of the healthy plate. I am not going to just say I'm going to eat healthy. Make it specific. Make it measurable. Are you going to do it for a week, a month? Achievable. If you are currently having a fasting time in your religious services, you're not going to be able to achieve 3 meals a day. So make your goals achievable. Make them realistic. If you know that you have 3 cartons of ice cream in your freezer, you may have to get rid of those ice creams before you can realistically say that you're not going to eat them. And make it time-based. Here's some goals that you might choose for this month. Eat 3 balanced meals. Use that healthy dinner plate or the diabetic dinner plate as your guide. Maybe the French fries once a week instead of every day for you. Or maybe you're going to decrease your fat intake by eating smaller amounts. Use that regular spoon for your salad dressing. Or maybe you're going to substitute something that was high fat. Or you're going to start the exercise before next month. You're going to do your 5 days of 30 minutes of exercise. Any and all changes to your lifestyle, I want to say, make sure are okay with your physician or provider and or your dietitian, because we are just giving generalized information. Don't do anything without your physician's approval. Or you can make your own goal. Commercial again, just wanted to remind you of our classes. Want to remind you of next month's prediabetes class, May 9th. Like I said, come ready to exercise. We're going to move our muscles. We are going to do some hands-on moving. Whether you can do exercise or not, I'm going to tell you, I am not an exerciser. So we are going to do easy to moderate, nothing too hard, but come prepared to finish our diabetic healthy eating plate and be active. References that we used for this module are here. And control your diabetes for life. I want to thank everybody who came, who listened to this presentation. I hope it was helpful a little, and hope to see you next month.